is Gerie DiPiano, and you are listening to the Love Mia Vita podcast. I'm here with my co-host, Dr. Catherine Sherif. And for those of you that haven't had the pleasure of listening to Dr. Sherif on our previous podcast, I'd like Catherine to introduce herself and her background. Catherine, nice to see you again.
Nice to see you, Gerie. So I'm Catherine Sherif. I'm an internist in Philadelphia and part of Jefferson Women's Primary Care.
So Dr. Sherif and I have known each other for about 2 decades. In her previous life, when she was at Drexel University and worked in the area of women's health. And then more recently, of course, we've had the pleasure of working with Dr. Sherif. She is also a member of FemPharma's advisory board, scientific advisory board, a key member of that advisory board. And we are so delighted to have you as our co-host, Catherine. Today, we are going to discuss something that is underappreciated, and it's a little gland that sits just below your Adam's apple, and it's the thyroid. And boy, can that thyroid wreak havoc on us if we're not actually prepared to understand all of the impact that it has on metabolic health. So first of all, there are a number of women who develop thyroid disease in their lifetime, and I did not appreciate this, but it's quite common. 1 in 8 women in their lifetime will develop thyroid disease. It's not just confined to mature women over the age of 40, but women may begin to experience thyroid issues even at a younger age during the height of their reproductive years into motherhood and beyond. So we thought it made sense for us to visit this and to specifically understand where is the thyroid located. Many women may not even understand where it's located. So where is it located? What does it do? Help us to understand this, Catherine.
Sure. So the thyroid gland is a very small, spongy, light gland that is, as you said, located below your Adam's apple. It's up against your trachea, and it's very difficult to feel through your neck because it's so thin. And for such a small organ, it has a great effect on your body. You know, think about the liver. The liver is about 200 times the weight of the thyroid gland, and yet the thyroid gland is so powerful. So it's in the shape of a butterfly, and it's laying flat against your trachea. And you usually don't notice anything unless it's enlarged or inflamed, and then you might have a sore throat or you might notice a bulge in your neck. And in fact, women who are pregnant, they often have a hyper-functioning thyroid because the thyroid gland controls metabolism. And so if you are pregnant and you have another human being that you're trying to nurture, your thyroid gland may become overactive. And that's often why you'll see women who are pregnant have a bulge in their neck, and that's their overactive thyroid.
So that's new fact for me, Catherine. I did not recognize that. It also has an impact on your menstrual cycle and can cause some problems with your menstrual cycle. Tell us about some of the issues that women can encounter that these would be younger women, of course, that would experience maybe some differences, maybe amenorrhea, which means no menstrual cycle, or perhaps a menstrual cycle that is unusual.
Yes. So since the thyroid gland produces hormones like thyroxine, which is or we call it T4, that controls metabolism, the thyroid affects every single organ and tissue in the body. And when it comes to menstrual periods, as you said, you can have no periods at all, or you can start skipping periods. And this is if your thyroid is overactive or underactive, if you're hypothyroid or hyperthyroid. One of the first things we're taught in medical school is that if someone's period or the pattern of your menstrual period changes, first thing you do is check the thyroid.
So it does impact, it impacts your ovaries, impacts your immune system. Again, these are issues that, or or I guess concerns that are underappreciated, it also may impact a woman's ability to conceive.
Absolutely. So it is a cause of infertility. And if you are having trouble conceiving, it's one of the first things that should be checked.
So we had a podcast recently with Shelley Bailey from Family, and a shout out to Shelley Bailey with Family because she's awesome. And this is one of the things that she does recommend to women who visit her and are seeking some support when they are struggling with their fertility issues. So, but this is the second time that I'm hearing this, but what tests should a patient ask for if they're pregnant or they're having difficulty getting pregnant?
Sure. So the first thing you would get checked is your thyroid stimulating hormone. Also, we abbreviated TSH. So you'll often hear a doctor referring to TSH. And the TSH comes from the pituitary gland. And when the pituitary gland senses that there's not enough thyroid hormone coming out of that butterfly-shaped gland on your neck, what happens is it releases TSH, thyroid stimulating hormone, to try to jumpstart the thyroid. So as the TSH goes up, it tells us that you're becoming more and more hypothyroid and that you're making TSH to try to jumpstart the thyroid gland. So we always check TSH. Two other tests that I think are important to check are the free T4. So and usually the free T4 will be going in the opposite direction as your TSH. So in other words, if you're not releasing enough free T4 from your thyroid gland, then consequently the TSH will start to go up to try to jumpstart it. So besides TSH, free T4, the third test I recommend is thyroid peroxidase antibodies. And these are antibodies against the thyroid gland. Your immune system makes them. And it's a common cause, the most common cause of hypothyroidism, called Hashimoto's thyroiditis, where you produce the thyroid peroxidase antibodies that mistakenly attack the thyroid gland. And so that can give us a very good snapshot of your thyroid function, and instead of just one test.
That's super helpful. And by the way, there was a lot of information that Catherine just shared. And so be aware that we will likely transcribe this and you'll be able to read this as a blog post as well. So you won't have to memorize all these things. And if you want to rewind this, you can rewind it and you can take the notes. But we are really happy that you were giving some helpful suggestions to women who may be listening to this, who are at various stages of their reproductive life, because we know that women who are listening to this Love Me Avita podcast may be women who are over the age of 40. That doesn't mean that you can't conceive. And so if you're fortunate enough to conceive even later in life, and by the way, we know that thyroid issues will rise with age. If you're having some problems during your pregnancy, because we know that if you're over a certain age, we are referred to as a geriatric pregnancy, you may want to also be aware of some of the impact that the thyroid may have on your developing pregnancy. So tell us about that as well.
Sure. So your needs for thyroid hormone increase during the pregnancy. And what would be ideal is if you had your thyroid stimulating hormone checked during each trimester. And if you're already on thyroid hormone, you may need to increase it in the second and third trimesters. And then what's interesting is after you deliver, whether or not you're hypothyroid and taking thyroid replacement hormone, your immune system may attack your thyroid gland in that year after pregnancy, and you may become alternately hyperthyroid, producing too much thyroid hormone, or hypothyroid. The thing is, you might never know because some of the symptoms of hypothyroidism and hyperthyroidism are fatigue or palpitations, depression, constipation, diarrhea, all kinds of stuff. And you may never realize that that you have a thyroid problem. So it's important not just to get checked during pregnancy, but also afterwards.
And leading up to this podcast, I know we joked and we said, sure, and after you have a baby, these are a lot of the kinds of issues that you're facing. So you're not getting enough sleep. If you're like me, you were up every 2 or 3 hours doing your feedings, changing the diaper, because we know they eat and then they defecate and they urinate, and you have to take, you have to be up. In my case, I took the mask and the earplugs out of my husband's ears and said, you know what, your turn here. Your turn. But I was exhausted. And I felt all sorts of aches and pains. And I did have heart palpitations because I was so worried about that baby. You can't ignore those things. Yes, those come with the beauty and the delight of having a child, but you may take Catherine's advice, and it may not be just what you're going through after you have this wonderful little child that you need to care for. It could actually be something with your thyroid, and you should at least investigate it. And I guess that's the theme of this podcast. We tend to want to attribute some of these symptoms to changes in our reproductive life, right? To the transition, whether it's menstruation, we talked a little bit about that, and menstrual irregularities, to motherhood and having children, or the difficulties conceiving. But the thyroid does and is impacted by age. And so as we age, and with our declining hormones, estradiol in particular, we do see that the thyroid may be impacted. And sometimes women who are in perimenopause, menopause, and in the whole transition process will start to exhibit symptoms that could be related to the thyroid. And again, as we indicated early on, 1 in 8 women in your lifetime. That doesn't mean that it is life-threatening, but it should be managed. So let's talk about why some women may be more at risk than others, and what's happening during the menopause transition, specifically with the thyroid. There's a lot of information here, so we can break it down. So what makes a woman at greater risk for developing a thyroid disease?
Well, just by being older. And so some guidelines say don't check the thyroid functions until age 45 or later. And that's a nod to the fact that we know that thyroid problems are more common as you get older and as you go through menopause. So some of the symptoms of hyperthyroidism, such as palpitations and sweating, are also, they resemble the symptoms of perimenopause. And so that, you need to know whether your symptoms, don't attribute your symptoms to the perimenopause. When you're in your 40s, you have to make sure you get your thyroid checked. But you were asking who is at risk. So just simply being overweight makes you more at risk for having thyroid problems. And the connection to your weight may be that your fat cells aren't just like depots where, we store energy and draw upon that energy. Your fat cells are also factories, and they produce all these inflammatory molecules. So they increase inflammation in the body. And so inflammation means that white blood cells are moving around and they're looking for something to attack, and then they attack your thyroid. And why your thyroid as opposed to something else, we don't know why it's so common. So again, the greatest risk of becoming hypothyroid, one is just age, simply getting older, but maybe even more important than that, it's family history. So if your sister, your mother have thyroid problems, occasionally your father will, but it is definitely more common in women. Sometimes it just seems like it's a matter of time before you become hypothyroid.
So, and there are, so we talk about the thyroid, we talk about thyroid diseases, and you've mentioned hypo and hyperthyroid, and it may not be something that everyone listening understands or appreciates. And you mentioned Hashimoto's. There's thyroiditis, which affects women postpartum. There's goiter. So let's first explain what is hypothyroidism, HYPO, hypothyroidism.
So hypothyroidism is when your thyroid gland is underactive. You are not producing enough thyroid hormone to run your metabolism efficiently. So the most common symptoms of hypothyroidism are dry skin, gaining weight, depression, constipation, even losing hair, as we mentioned before, irregular menstrual periods. Those are very common. One show-off category of hypothyroid symptoms is something called Queen Anne's eyebrows. And doctors love to ask students what Queen Anne's eyebrows are. And Queen Anne was an old queen. And if you look at paintings of her, she's missing the outer third of her eyebrows. And so that's a classic symptom. Yes, all your eyebrows are there. So that's that's cocktail party talk, Queen Anne's eyebrows. But what's confusing is how many women do you know who are overweight, constipated, depressed, and tired?
I think there are a few that I can, I know I have all those symptoms. I mean, constipation is also an issue. Regularity is also an issue for women as they age, right?
Yes. Yeah. Why are so many women constipated? And it's like an epidemic. So yeah, so those are the most common symptoms. And then sometimes I will look, if you look at an EKG, you'll see a slow heart rate. Well, now everybody has an Apple Watch. And so that you can see that your heart rate may have dropped to the 50s or 60s. So and then the opposite symptoms are seen with hyperthyroidism when you're overactive.
So when you start to exhibit these types of symptoms, again, it could be nothing more than these are menopausal symptoms. It could be something that is, triggers you to visit your primary care practitioner, your endocrinologist, but probably your primary care. And again, these are, there is certain amount of testing that your primary care may recommend. Again, this is by no means a diagnosis. During this podcast is simply a podcast. We're simply imparting information. You want to visit your physician and make sure that she is the one that takes responsibility for all of these things. But we can shed some light on some of the tests. So the tests would include same tests that you recommended previously or different?
Yes, the same tests: TSH, free T4, thyroid peroxidase antibodies, and we abbreviate that TPO.
So we have hypothyroidism. There is a massive laundry list of symptoms and associated side effects. I think you hit on the major ones. There's also hyperthyroidism. So
Sure.
what is
So
going
with
on?
hyperthyroidism, you're producing again, it's usually the immune system attacking your thyroid, but instead of killing it, now it's stimulating it to work harder. And so your metabolism increases. And so if you think of it that way, your heart rate, it would make sense. You'll have palpitations, your heart rate is high. Sometimes people who have uncontrolled blood pressure problems, they'll keep getting more and more and more blood pressure medications until someone checks their thyroid and says, oh, you're hyperthyroid. Okay, so your blood pressure is very high. They'll often get diarrhea. They'll be nervous, anxious, have trouble sleeping. They are sweaty. So that, and sometimes they'll lose weight, but not always.
So again, as I think about these symptoms, they sound an awful lot like perimenopause, menopausal symptoms, but is it the exacerbation of what we may be experiencing when we hit perimenopause and menopause that really should trigger some concern? So let's just say for the sake of conversation that in my case, I don't really have, I have a few issues with hot flashes and night sweats, but I'm not ripping my clothes off and during the day, thank God, it horrified people. But my husband would love it if I did it at night. But um, I'm not, too bad with the hot flashes. And occasionally, I'm having insomnia. Actually, I should say more than occasionally, I have insomnia, but all of a sudden, those symptoms, now I'm like having hot flashes like 10 per night. And I am really uncomfortable during the day. And I put a fan in the office and, forget sleep, it eludes me. I make my bed, right? When is it time to say, maybe this is not just menopause or perimenopause?
Sure. So if you see an acceleration of your symptoms, if something changes, and it doesn't, if the pattern changes, it's time to talk to your doctor. You may notice that your heart rate is 110 and you didn't used to run 110. That would be a great way to pick up hyperthyroidism. So it's basically looking for a change in your symptoms.
The one additional fact that I was unaware of is that sometimes hyperthyroidism may increase your risk for osteoporosis.
Yes. Isn't that interesting? So you have increased bone turnover and we're constantly breaking down bone and building bone. And it's a balance between two types of bone cells. And so constantly forming and reforming. But what happens with hyperthyroidism is that you end up with net less bone. You have less bone than when you started, which is very interesting.
So again, this is another potential red flag. If you're a woman that has not really exhibited any of these other symptoms, you notice that you're breaking bones. All of a sudden, you're running, you break the bone in your toes, you break your wrist, just from a simple, you're doing a plank, and before you know it, you have a wrist fracture.
Yeah.
You've not had any other issues in the past.
Yeah.
And perhaps you don't have any risk factors in your family. We talk about having a DEXA. Maybe that is another indication that you're exhibiting symptoms or you have osteoporosis. But clearly, if you have hyperthyroidism, it's probably something to watch out for, right?
It is. And usually the people who are most knowledgeable about the thyroid and want to make sure that their thyroid is checked are women who have family members with thyroid problems. Otherwise, people don't really think about it. And so we need more awareness. If you're, if you have fractures and they don't make sense, like it's one thing, like, I was riding my bike, I was hit by a car, I fractured 3 ribs. Okay, so that's a pretty good excuse to have.
Hey, did that really happen, Catherine? That
happened.
It happened to you.
It happened to me. It was such a bummer. And I couldn't breathe for a month.
Horrible.
Right. However, so you got to have a good reason to break a bone, right? So if you have fractures and it didn't take much, we need to find out why. So, for example, a DEXA scan to look at bone density is a great idea. And if you are osteoporotic and it doesn't make sense, then, for example, if you're a smoker, you're much more likely to be osteoporotic. And if you're a drinker too, but that may be a clue that you're hyperthyroid and your thyroid needs to be checked.
So we've talked a lot about various diagnostic tests that women should be mindful of, and also to the symptoms for both hypothyroidism. I believe that there is hope, and although there is no cure, right? It's
No
not
cure.
it's not terminal.
No.
There are some ways in which we can, or your doctor, your healthcare practitioner can address your symptoms with medication. Let's talk about some of the treatment options that can be offered to you.
Sure. So if you are hypothyroid and you are not producing enough thyroid hormone, fortunately, we have levothyroxine, which is synthetic T4, and that will pretty much take care of the problem. It has to be taken on an empty stomach, or you won't absorb it well. And we check thyroid stimulating hormone every 6 weeks to make sure you're on the right dose, and we can adjust it. If you're hyperthyroid, we have medications that can quiet down the overproduction of thyroid hormone. Hyperthyroidism, where you have too much thyroid hormone, is not as common as hypothyroidism.
Now, what side effects are associated with these medications? And I hate to say it, but if you have an is there an exacerbation of menopause symptoms if you are taking these types of medications? What are these offenders, so to speak?
So you would most likely see side effects with thyroid hormone replacement. So if you're getting the right amount of replacement, it's not extra, we're just replacing it. But let's say for some reason you were taking too much, you would then end up a little bit on the hyperthyroid side, and you might have anxiety, palpitations, sweating, increased heart rate, increased blood pressure, and so on.
So you want to get it right. So it's increasing or adjusting the dose so that it is actually an appropriate dose for you is something that we need to pay attention to. So if you are being treated for one of these conditions, you want to monitor your side effects as well, because these doses can be adjusted accordingly. And we often think that whatever we walk out of the doctor's office with, prescription, that it is the prescription, it's going to solve all of our problems, and it might, but watch out for your side effects, report them back to your healthcare practitioner. She can make the adjustment if necessary. Doesn't mean you should discontinue your treatment unless you are advised to do so by your healthcare practitioner, because oftentimes we don't comply. So we have a side effects, we don't persist. When our blood levels even out, we start to feel better, but we have to be mindful of those side effects that really impact our quality of life. And so I guess that's maybe a message for our listeners, that if it's significantly impacting your quality of life in a negative way, that's probably the time to call your healthcare practitioner. Any other words of wisdom on your treatment options, Catherine?
Well, yes, this is controversial in some circles, but there are formulations of ground up pig thyroid. The one that people know most is Armour thyroid. And some people prefer that because it has T4 in it. T4 is the one that we replace, but it also has T3. Now, most of us, our thyroid hormone converts T4 to T3, and T3 is active and it acts on our body. One of the reasons that people like to take Armour thyroid or other pork-derived thyroid formulations is that they have T3 in them, and they're afraid that they might not be making enough T3, and that's why they want to take it. If my patients ask me for Armour thyroid, I will prescribe it, and because they feel better on it, and that's fine with me.
So lots of different ways in which to deal with these types of concerns with our thyroid. It is definitely something that is manageable. We deliberately didn't talk about thyroid cancer because it is relatively rare. Obviously, if you notice that you have an enlargement in that area, a nodule, you should have that investigated. And when should you be concerned? And what does that feel like if you are, if you're trying to find your thyroid right here, this area here, right? Near the trachea,
Yes. Yeah,
you
right in front of the trachea.
well, you feel something unusual, what would you feel, and when should you make that appointment?
Sure. So, first of all, the way that it looks. So if you look in the mirror and you see a lump in your neck, then of course you've got to go to the doctor. Or someone may tell you, what's that bulge there? Was that there before? Sometimes the thyroid will be enlarged, and an enlarged thyroid is called a goiter. And often you'll have a lump, but it'll be squishy. Sometimes the lump is hard. So it really depends on what's there, and it's not necessarily cancer. And as you said, thyroid cancer is rare. But any changes, any lumps or bumps. Now, if your thyroid is inflamed because your immune system has attacked your thyroid, so that would be called thyroiditis, an inflamed thyroid, you may actually have a sensation of a sore throat. You may feel that when you swallow, that you're hitting something while the food is going down. So you're not exactly having trouble swallowing, but it doesn't feel right when you swallow, and it's hard to describe. Then you need to see someone to examine your thyroid and have thyroid testing. I'll tell you something else. I keep thinking about the thyroid, about how much it controls metabolism. Every once in a while, this probably happens once a month, I'll look at someone's cholesterol tests, and for the first time ever, their LDL, the bad cholesterol, starts to go up. And it's never been up before. That is a clue that you are hypothyroid. Or if you develop high blood pressure out of nowhere and it's never been an issue, that's another clue. Or if your sugars are starting to go up. So you can see it affects 3 of the major risk factors for heart disease. Your blood pressure goes up, the cholesterol goes up, your sugars are starting to go up, and you're not diabetic, but you're sort of creeping towards pre-diabetes. Again, it affects so many areas of your health.
So if I visit my primary care practitioner for my annual checkup, and let's hope that we all take good care of our health by having that annual exam, or perhaps more frequently if you have some other health challenges. When we have these symptoms, we should be reporting them to the healthcare practitioner. We should also, if we have lab work done, what advice do you have for women who are their HCPs, their healthcare practitioners are ordering lab work, and let's say that they've ordered all of this. They've LDL, HDL, TSH, T3, T4, all of what you just recommended. What do you recommend in terms of appreciating what you have in a report? I mean, obviously, we're not all physicians. We're not going to make the determination, but what do you recommend that women do with this information?
Well, it would be helpful if your clinician went over the blood tests one by one. Your complete blood count is normal. Your blood chemistry is normal. Your liver function test is normal. And if they went through one by one, it does take a lot of time. And I'm still trying to catch up from the beginning of the pandemic. What happened was there was an avalanche of people coming out after the pandemic, and we're all at once and getting blood tests that they hadn't had for 2 years. So your doctor may be behind. It's perfectly fine to contact your doctor and say, hi, have you had a chance to look at my blood tests? And can we go over them one by one? If you see something, so what I would say is don't accept yeah, everything was fine. All right. But if you see something that was flagged as abnormal, it's perfectly fine to say, why is it flagged as abnormal? And is what do I need to do about it? Do we need to repeat it? Do I need to, or just check it every year? So you really should not have any questions left from your practitioner after you go through the blood tests.
So we don't want to be that whiny patient so that the
Yeah.
doctor pops out and says, you know what, I'm gonna send you to the cheese shop. But we all know those individuals, right?
Yeah.
We see them everywhere, but it's important to be your own best advocate, right? You have to self-advocate. And let's face it, if you have knowledge, and this is the goal of what we do on the Love Me Avita podcast and in the Femme Pharma blog, our goal is to impart knowledge, to make you smarter, and to help you to think about some of what may be impacting you at this time of life. We know all these women and men who are listening in, reading, are really smart, but they're not all doctors, they're not all scientists. So we want to make sure that they understand that they have the knowledge. We're arming them with the knowledge to be able to ask the right questions, not in a mean-spirited way or in a challenging way, but in a way that helps to serve them best and to navigate through whatever they may be facing in health challenges, or to celebrate the fact that things are great and they've done a super job of taking care of themselves. So it's just being smarter, and we could all use a little bit more of that. You know, we tend to read a lot of garbage on the internet. We tend to listen to things that aren't necessarily well curated, or perhaps they are being promoted by less than knowledgeable individuals. In our case, healthcare practitioners and professionals like Dr. Sherif can provide that knowledge that you can use with your healthcare practitioner. Again, not as a challenge, but really as a source of information and as a resource. So, Catherine, we always want to leave with 3 key points. So what are the 3 key takeaways from this podcast?
Well, number 1 takeaway, I want you to remember and familiarize yourself with the symptoms of hyper and hypothyroidism, because thyroid disorders are common. And the most common hypothyroid symptoms are fatigue, weight gain, depression, constipation, dry skin, hair falling out. And don't forget Queen Anne's eyebrows.
Yeah, eyebrows.
The most common symptoms of hyperthyroidism are anxiety, diarrhea, palpitations, sweating, and insomnia. And there are more. Okay. So number 1, learn the symptoms of hypo and hyperthyroidism. Number 2, check with your doctor if you get thyroid tests on a regular basis. And it doesn't have to be every single year, but you should have them. And then number 3 is more general, is understand your blood tests and don't just accept someone's word that they're fine.
There's a lot that can be learned from looking at blood work, and sometimes we miss an important piece of data. Physicians are human beings. They are not gods or supreme beings in white coats or scrubs. They make mistakes, and they, as Catherine illustrated, boy, we have had an onslaught of issues, starting with the pandemic, that resulted, I use your words, the avalanche of patients who are returning to their primary care practitioners, which is awesome that they're returning, but it really has put intense pressures on the healthcare practitioners, who all want to do a great job. But when you're seeing 35 and 40 patients per day, I'm sure it is a challenge. And I know that you and I have had this conversation in the past, and I've had this conversation with lots of different practitioners, gynecologists, dermatologists. I'm guilty of it myself. I have seen pretty much every practitioner in the last year that I missed when we were in the pandemic. So I'm sure that, they're sick of seeing me. It's a
I
very,
doubt that.
well, this is, when you have a little bit of knowledge, it also sometimes becomes the whiny patient, and that would be me. I try really hard not to whine, and if I do, I try to bring something to the doctor.
Oh,
so they don't-
Gerie, I bet you don't whine.
I try very hard not to, but I do recommend this. If you are dissatisfied, and Catherine's probably going to plug hers, if you're dissatisfied with the health care practitioner that you are seeing because she or he is not paying attention to your needs and not providing you with compassionate care, and I put the emphasis on compassionate care, then you need to divorce that person. It's possible that you have outgrown one another. Maybe they think you're the whiny patient. But perhaps it's just because you aren't getting what you need from your healthcare practitioner. There are lots of great healthcare practitioners out there. We've met many of them. We work with many of them. And so there is the right fit for you. Dr. Sherif, as you know, is a practitioner and professor of medicine at Thomas Jefferson University Hospital. And if you live in the mid-Atlantic states, I'm sure she'd be more than happy to take you on as a patient, even the workload, Catherine. But Dr. Sherif is not giving medical advice during this podcast. This is for informational purposes only, and it is not meant to replace your interaction with your healthcare practitioner. As I said, if you'd like to make an appointment with Dr. Sherif outside of this discussion, I'm sure she'd be happy to have a conversation.
Absolutely. And feel free to contact me, catherine.sherif@jefferson.edu.
Catherine, as always, it's a pleasure to have you as our co-host, my co-host on the Love Mia Vita podcast. Stay well. We love having you. It is always our pleasure, my pleasure, and we love working with you. And to our audience, please take care, to your good health, and remember, love Mia Vita.